Bone age estimation and dentition always bothers you. Correct. You are not able to understand, you are not able to remember it. So here is your solution. I have made few slides on bone age estimation and dentition in a very easy language. I take a guarantee that you are going to like it, you are going to enjoy it, and you are going to remember it for your lifetime. So do not skip anything. Please watch this video till end. Let's start learning. I am Dr. Triyavirani Malde, pediatrician and consultant neonatologist, and I'll be your guide for pediatric journey. Please subscribe my channel if you have not subscribed and give like to this video. Before actual starting, I seek blessings from all my teachers as well as God to bless us all with knowledge and wisdom to shape our life. So for the ease of understanding, this part is divided again into two parts. Part 1 will be dentition, part 2 will be bone age estimation. So let's start with part 1, that is dentition. So what is dentition? It really includes a mineralization, eruption of teeth and exfoliation of the teeth. Initial mineralization will start from the second trimester of the intrauterine life. If you remember the growth part 1, everything starts from the intrauterine life. If you have not gone through that series 1 and 2 lecture, I do suggest please go through it. Link is in the description box. So initial mineralization starts very beginning from the second trimester, and mean age for the eruption of the central the development of the central incisor is 14 weeks. It starts developing from the 14 weeks of the gestation. So what is primary dentition? Primary dentition or a milk teeth, what is it? So let's now understand it. What does it mean? Primary dentition is also known as a milk teeth. It is 20 in number. We have to remember it. It is 20 in number. It starts around 6 to 7 months of the life, and it is completed by 3 years of the age. This has to be remembered. These are few facts you need to remember it. That it is known as a milk teeth also. It is total 20 in number. It starts at 6 to 7 months of the life, and it is completed by the 3 years of the age. Now if you compare the secondary dentition, it is called permanent teeth. It is 28 to 32. We all know that. एक झापड़ लगाऊंगा 32 से निकाल दूंगा. So it is total 32. Why 28 to 32? Because wisdom teeth may not be present in all the normal individuals. So it could be 28, it could be with addition to wisdom teeth, it is 32. Starts at the age of 6 years. So here again you have to remember, primary starts at 6 months, secondary starts at 6 years, and it is completed by the age of 12 years. So question number 1, again it's a trivia time. My lectures are always with concept as well as MCQ, so you will be at least solving few of the MCQs in the lecture only, and 6 to 7 minutes, 6 to 7 MCQs, not a bad deal, right? So let's have a first multiple choice question. Primary dentition begins to show teeth eruption by, your options are A 6 weeks, B 12 weeks, C 6 months, or it is D 12 months. I do suggest please write answer in the comment box along with the question or else in the copy, because we'll have an upcoming video on the MCQ keys along with the concepts. Question number 2. By what age all milk teeth are erupted? Your options are A 1.5 year, B 2.5 year, C 2 years, or it is D 3 years. Question number 3. Total number of milk teeth in human being are, it's C here, it's milk teeth. So read the question always carefully. Options are A 20, B 28, C 30, or it is D 32. Now primary dentition, the first tooth will be erupted, will be lower central incisors. For this you have to remember any infant near you. If you see any infant, they have a small tiny cute teeth in the lower jaw. So lower central incisors are first to appear as a primary dentition, while if you take a last, it is a second molar. We'll have an easy pictograph for this in upcoming slides, so please keep on watching. Secondary dentition, the first tooth will be first molar. Here no incisor, it is molar. And then the last tooth will be third molar. So how we can remember it? Lower central incisor, first molar, second molar and third molar. You have to make a Z. Primary secondary dentition, first tooth and last tooth. Lower central incisor, first molar, second molar and third molar. Just arrange into the table and you will be remembering it. So if you take a milk teeth, how we are going to remember? You have to divide the jaw in two parts. In each quadrant, there will be a 5 teeth. If you start taking from here, these are all upper teeth, these are all lower teeth. Here it is a central incisor, it is lateral incisor. Then this is first primary molar, this is second primary molar. Right? So these are incisors. These 4 teeth are incisor. These are cuspids or canine. Remember this, canine. Okay. So you have to remember like this. First 4 teeth will be central incisors and lateral incisors. Those are 4. Then 1 canine, first molar and second molar. Total 5 in number in each quadrant. So 5 into 4, it will be total 20 into the number. No P in above word. See, milk teeth. Can you see any P in this? No. So no P in the above word. So no premolar in milk teeth. Remember this. In a milk teeth there is no P. So no premolar. Only central lateral incisors, canine, first primary molar and second primary molar. Now we have to again remember. For that you have to remember LCI, UCI, UCI, LCI. Arrange in a sequence like LCI, UCI, UCI, LCI. Like last 2 things are same, in between middle 2 things are same. So LCI 6 to 7 months, then you have to just keep on adding 1 month. LCI 6 to 7, UCI 8 to 9, UCI 9 to 10 and LCI 10 to 12 months. Lower, upper, lower. Lower, upper, lower. LCI, UCI, UCI, LCI. LCI 6 to 7 months, UCI 8 to 9 months, UCI 9 to 10 months and LCI 10 to 20 months. After that we have to remember MCM. LCI, UCI, UCI, LCI, MCM. MCM starts again where we ended at 12 months. So 12 to 15 months, 18 to 21 months and 21 to 24 months. Just take a picture of this slide in your mind. Nothing, it's not a rocket science. If you see these slides 1 or 2 times, you are going to remember it easily. LCI, UCI, UCI, LCI. 6 to 7 months, 8 to 9 months, 9 to 10 months and 10 to 12 months. Then MCM, first molar, canine and second molar. This is order of eruption. So question number 4. Again trivia time. Which of the following is the first incisor? It's a first incisor to erupt in infant. Lower central, lower lateral, upper central or lower central. Please write in the comment box. Question number 5. First teeth to erupt is first molar, premolar, incisor or it is canine. Now let's learn about permanent teeth. If you take a permanent teeth into the consideration, it will be 8 in each quadrant. Which of them will be there? We'll learn in upcoming slides. So permanent teeth, if you divide each quadrant, there will be 8 teeth in each. There will be 2 incisors, central incisor and lower lateral incisors. The pink color is for incisors. So 2 incisors, 1 canine. There will be 2 premolars and there will be 3 molars. How you can remember it? I can play more. I stands for incisors. There are 2 incisors, canine, 1 play, premolar and more for molar. And you can remember this number also 21, 23. So in each quadrant 2 plus 1 3 plus 2, 5 plus 3, it will be 8. So in each quadrant we will have a 8 teeth, provided that there is presence of wisdom teeth, because wisdom teeth may not be erupted in all individual. So 32 minus 4, it will be 28. So it could be either 28 or 32. Now, how we are going to remember the order of eruption? It is very easy. We are going to remember it with one simple sentence. Mama is in pain, Papa can make medicine. So how it's going to start? First molar. AM stands for Mama. First molar, central incisor, lateral incisor. Mama is in pain. Again, P stands for premolar. Papa, second premolar. Canine can make, second molar, and here third molar. So how we are going to remember? Obviously the first will come first. So first molar, central incisor, then lateral incisor, then first premolar, then second premolar, then canine, then second molar and third molar. Just remember the sentence, Mama is in pain, Papa can make medicine. Now how we are going to remember the age? You have to simply add 1 to all. You have to start with 6 and you will be ending at 12. So first molar, Mama, 6 years. Central incisor is 7 years. Lateral incisor in 8 years. First premolar for pain, it is 9 years. Then premolar 10 years. Canine 11. Second molar 12. And third molar between 18 to 25. Isn't it easy? Mama is in pain, Papa can make medicine. So now let's have again trivia time. Question number 6. At what age the permanent teeth appear? So we need to know which age the permanent dentition start. The options are A 5 years, B 6 years, C 7 years, or it is D 8 years. Question number 6. At what age first molar permanent teeth appears? Options are A 4 to 5 years, B 6 to 7 years, C 7 to 8 years, or it is D 9 to 10 years. Question number 7. First permanent teeth to appear. Your options are A molar, B premolar, C incisor, or it is D. Many a times many students will tick to the incisors, but it is not a permanent. You have to again read the question carefully. It is about permanent teeth and not primary dentition. Question number 8. How many permanent teeth will be present in an 8 years old? So we have to calculate again one quadrant and then we have to count it for 4 quadrants. So your answers could be A 20, B 24, C 12, or it is D 16. It is very easy to count. Please stay connected for the next video, because upcoming video I'll be cracking the clue how to count the teeth according to the age. So let's move on. Now after learning about primary and secondary dentition, I hope you all learnt well. Nothing much is there. You have to just remember 2 mnemonic, I can play more, and second is Mama is in pain, Papa can make medicine. Now we'll move to the natal teeth. What is natal teeth? It is also known as a congenital teeth. Usually newborn baby doesn't have teeth. Whatever we have discussed that dentition start forming in utero will not be erupted. It will be all inside the jaw. So newborn baby doesn't have teeth, we all know, because they don't need to chew. The chewing will start after the 6 months. That is again you can remember by that way, that babies start eating complementary food after the 6 months of the age. So teeth eruption starts at the age of 6 months. So if the newborn has a teeth, then it is called natal teeth or a congenital teeth. Natal teeth could be idiopathic, without adeno finding, without association of any symptoms, but it could be as a part of these syndromes also, like Soto's syndrome, Ellis-Van-Creveld syndrome, epidermolysis bullosa, or it could be a part of Pierre-Robin sequence. What is Riga-Fetch disease? Because of natal teeth, there will be a continuous pressure and the erosion of the tongue, specifically in a newborn. So This is called Riga-Fed disease, in which there will be a laceration of the tongue and there could be a amputation of the tongue also. Here it is simple ulcer, but it could be amputation, like it can be the cut in the tongue also. Usually we do not do anything for the natal teeth, but if it is a very loose and hanging, there is always a chances of aspiration that while taking feed, the teeth will go into the trachea and there could be a chances of breathing problem and unwanted situation. So in that scenario, we may ask pediatric dentist to remove or extract the loose hanging natal teeth. Now, after learning about natal teeth, let us learn something about supernumerary teeth. What is supernumerary teeth? It is a extra. Supernumerary means there will be extra teeth in the jaw. Most common location is between the incisor. You must have seen in many that there are extra teeth hanging on the jaw. So inside the mouth. So it is seen, most common location is between the incisors. It is seen in cleft lip, palate, cleidocranial dysplasia, or it could be a part of Gardner syndrome. What is the most common location of the supernumerary teeth? We have just discussed it. Your options are A between incisors, B between canine, C between molars, or it is D between premolars. Now after the supernumerary teeth and natal teeth, let us have some discussion on delayed dentition. If you take a delayed dentition, when do we call it delayed? Many a times I have been asked that, look, my child is not having hair or a teeth. So my answer would be, I have never seen any child without teeth and hair, so do not worry. But when we should worry, when parents are asking us that still there is no teeth in the mouth of my child, should I worry? Then you should be knowing the answer. It is called, there is no teeth eruption by approximately 13 months of the age, that is 1 year, by first birthday plus 1 month, that is mean plus 3 standard deviation, then we call it a delayed dentition. Sometimes when we are discussing a delayed dentition, just to complete the list, I have taken these two things. In a precocious puberty or a hyperparathyroidism, we may encounter advanced dentition. That will be again mean plus 97 SD. So, what are the causes of delayed dentition? If you take a causes, the first and foremost, it runs in family. Few families have a tradition or a tendency to have a delayed dentition. It could be because of ricket, it could be idiopathic, we could not find any cause. It could be a endocrine causes. Hypothyroidism is very important for you to remember. Hypoparathyroidism as well as hypopituitarism could be part of a Down syndrome, could be cleidocranial dysplasia, or it can be a progeria. Here, for exam point of view, ricket is very important, hypothyroidism is important, and Down syndrome is important. These two is for you to remember as a cause of delayed dentition. Question number 10. Delayed dentition is considered when there is no tooth by the age of, your options are A 9 months, B 11 months, C 13 months, or it is D 15 months. Question number 11. Which of the following is true about eruption of the teeth? See, read the question carefully. We need to select the answer which is true. Okay, so we need to find the correct statement out of these 4 options. Option A. Premolar appear first as a primary dentition. Incisors appears first in a secondary dentition. Third molar is last to develop. D. Hypothyroidism delays the dentition. E. Canine is last to appear in a primary dentition. Now you have to recollect all the facts in reference to dentition. Then only you will be able to answer this question. Question number 12. What is false about dentition? So what is false? We have to again search incorrect statement among these options and then we have to answer the question. It is false, so we have to select incorrect, wrong. Hypothyroidism delays the dentition. B. Premolar is not seen in a primary dentition. C. Third molar is last to develop in secondary dentition. D. Canine is first to appear in primary dentition. That conclude part 1, dentition. Let's have some relaxation. Stretch your arms, stretch your legs, breathe in for 5 times, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Let's move to now bone age estimation. Being an undergraduate or a postgraduate student, I was always confused about bone age estimation. When it was like a medical legal case and I need to have a X-ray, when my consultant asked me to take an X-ray of this girl or a boy as a purpose of a medical legal case, I was always confused. Which X-ray to be taken, in what position to be taken. Most of the time it is decided by radiologist, but being a pediatric resident, I was very much curious. But whenever I was reading a bone age estimation, I was lost because there were so many heavy terminology in it, ossification centers, metaphysis, epiphysis, and so on, diaphysis. So it was always confusing for me. I have tried to make it very simple because I have also passed through that stage. I was not able to understand bone age and X-rays. So let's start again learning about bone age estimation. Before learning bone age, we should know something about ossification centers. It was very confusing for me also, so I have simplified it for your sake. Let's see. Before learning ossification center, let us know some bone facts. As a person grows, starting from intrauterine life, everything starts from intrauterine life. Series 1 was also telling same thing. If you have not gone through that series 1 and 2, I suggest please go through it. The link is in the description box and I button is also available. So it starts from the fetus, childhood, and then puberty, and then adulthood. As the person is growing, the bone also grows. It changes its size and shape. And this changes, whatever changes is there in the bone of a child or a adult or adolescent, it will determine the age of the child, because certain changes of bone happens at certain age. So how does the human skeleton of infant differs from adult? You will be amazed to know that baby is born with more than 300 bones and it is more than the adult. The bone starts fusing and become one. So adult has only 206 bones, which is lesser than the infant, because those 300 bone more in number will fuse together as the time passes. Another very important fact about the bone that we should learn: if you take a bone of an infant, it is divided into 4 regions. This central part, this part is called diaphysis. Okay. Then the end part is called epiphysis. Okay. The part between the epiphysis and metaphysis is called physis, and this part is called metaphysis. So the bone of an infant has 4 parts: diaphysis, metaphysis, physis, and epiphysis. While in adult we have only 2 parts. The central part is diaphysis and end part is metaphysis. So the adult bone has only 2 regions, that is diaphysis, and the lowermost part will be called metaphysis. Another bone fact we should remember for general knowledge as well as a purpose of a multiple choice question is that femur is the first bone to start forming at the around 5 to 6 weeks of the gestation, and to your surprise it start finishing all the bone work by the age of 21 to 25 years. Because it's a long bone of the body, it carries the weight of the person, so it starts forming very early in the life, 5 to 6 weeks, and it continues till the 21 to 25 years of the life. So now after learning this bone fact, that how many bones are there, what are the part of the bone, how does it differ from for infants to adult, what is bone age? Nowadays it was very much important for us to learn about bone age, so let's learn it in very simple language. That it indicates a physiological development and it is very helpful in estimation of maturity of child's bone. In again simplest language, if you see, it is assessed by the number, presence of number, shape and size of the centers, density, size and shape of the end of the bone. So bone age is determined by how many numbers are there, what shape it is and how many centers are there. Again in a easy language we can remember it. Now the first question arrives again, that what are the ossification center? Those are the center from where the bone formation begins. Those are the center, the part of the bone from which the ossification will start. Those are called ossification center. So there are two types of ossification centers. One is primary. Primary is first area of the bone which start ossification. It is located in the central part of the bone. See, this part is primary and it appears in a prenatal development. While if you see the secondary, it appears of the primary and it is located at the edges of the bone. This is yellow arrow shows the end of the bone is the secondary, while the center part is called primary ossification centers. Now, if you remember this, femur distal and ossification center is present very starting from the birth. Distal end of the femur and the tibia proximal end both is present at the time of birth. If you see the humerus, head of the humerus is present by the 3rd week. Femur head is present 4 months plus or minus 2 months and patella is present by 2 to 4 years. So you have to remember femur distal end and tibia proximal present at the birth for the ease of the remembering. Humerus head 3 weeks. Femur head of the femur by 4 months and patella by 4 years. This is the way you can remember 4 months and by 4 years. This is the order you have to remember: femur distal end, tibia proximal end, humerus head, then again go to the femur head and then patella. Imagine a skeletal in your mind and then you will be easily remembering femur distal end, tibia proximal end, both at the time of birth, and then humerus at 3 weeks, again at the femur head 4 months and patella at age of 4 years. Again at the time of birth, as we said that it is present, the femur distal end, distal ossification center is present, but lower femoral epiphysis appears at 36 weeks while upper tibial epiphysis appears at the age of 38 weeks. See, it is very important because once the child is preterm, less than 37 weeks, we call them preterm. If the child is born before the age of 37 gestational age, we call that baby preterm. So this presence of epiphyseal center help us to determine the maturity of the child. There could be a MCQ from this kind of the X-rays. So our question number 13, the first question for the bone age would be: the first epiphyseal center appears in which bone? A. Femur, B. cuboid, C. clavicle, or D. ossicle. I do suggest please write in the comment box or in the copy. We'll have a discussion in upcoming video. Question number 14. What is the most probable age of the child? Age of this newborn. See, we have to see the X-ray of knee. Again, we have to see for the presence of centers. And according to the centers, we should all know that what is the age. Your options are A. 34 week, B. 36 week, C. 38 week, or it is D. 40 week. There is one more clue here. Otherwise the first bone to ossify is a femur, but the earliest ossification center will appear in which bone? Here, calcaneus. What are other ossification center those are present at the time of birth? Those are distal end of the femur, proximal end of the tibia. We have already known that it could be a head of the humerus and it can be talus and cuboid. These centers are already present at the time of birth. So what is the bone age? Again the same question arises, that the presence of primary and secondary ossification centers, the fusion of those centers, and both the thing occur at a specific age, and that refers to bone age. Primary center and secondary center appearance occurs at the specific age, as well as their fusion occurs at the specific age. That is referring as a bone age. We have to accumulate all of our knowledge in reference to bone, and then we can come to conclusion as a bone age. So I think it's so simple. Now ossification centers are clear to you, the bone facts are clear to you. What are the centers? Those are present at the time of birth. What are the earliest centers? Those are present at birth. And what is a bone age? So I hope you all understood this in a very easy language. You have to just revise it once. If you are getting confused, watch this 2-3 minute part again and again, and you will be clear with all your concept in reference to bone age. To do the bone age estimation, there are few methods. We cannot do it haphazardly or randomly, and gold standard method is Relic Pile Atlas. They are following the Atlas. The other method is Tanner Whitehouse method, and the last method is Gill's Retibing Atlas. So these three methods could be used for the bone age estimation. Now, which type of X-ray we should take when we are going to estimate the bone age for a particular child? If we are doing bone age estimation at birth, we all know we should take X-ray of knee. X-ray of knee at the time of birth. If we are having a child who is between 3 to 9 years, then we should use shoulder. If we are having a child who is between 1 to 13 years, then wrist is important. Everybody knows about this thing because we have learnt in anatomy, we have learnt in radiology, and now we are learning in pediatric also that if the child is between 1 to 13 years, wrist is the site of choice for taking X-ray for bone age estimation. Between 12 to 14 years, we have to take either elbow or hip. Now question number 15. Which of the following X-ray should be advised for bone age estimation between 1 to 13 years of age? We all know it. We have just gone through it. Your options are A. shoulder, B. wrist, C. elbow, or it is D. iliac bones. Please do write in the comment box according to the question number. Now there is a formula. If we know that wrist X-ray should be taken between the age of 1 to 13 years, now how we are going to remember the age of the child? So we need to see the number of carpal bone. Whatever the number of carpal bone is there, we have to minus 1. That will be the age of the child. If there are 5 carpal bone, then the age will be 4 years. If the 7 carpal bones are there, the age of the child will be 6 years. Whatever carpal bones are there, we have to just deduct one number to come to the age. Isn't it easy? Super easy. But as by 1 year, we are having 2 carpal bones. But we should know that first carpal bone is capitate and then hamate. For that, we have to remember cap and head. Cap is always worn on the top. So capitate will come 1 to 2 months, but hamate will come between the age of 2 to 4 months. Sometimes it is asked that the first carpal bone to appear, so you should know it is capit, and then hamate, 2 to 4 months. So by the age of 1 year, we'll have a capitate and hamate. So your question is, at the end of 1 year of age, number of carpal bones are seen in the skygram of the hand is? Answers are A. nil, B. 1, C. 2, or is it D. 3? Question number 17. You order a wrist X-ray for 2 months old child. Read this carefully. It is 2 months old child. Which carpal bones are you expecting to be present? A. capitate, B. scaphoid, C. lunate, or D. trapezoid. I think with my trick you will be able to answer this question quickly as well as easily. Now question number 18. What is the most probable age of this child? This X-ray you have to see, you have to count some bone, and then you will be at your Conclusion. Your options are A 6 months, B 1 year, C 3 year, or is it D 7 year? That concludes bone age estimation and dentition series. It is super amazing and super easy for you. I hope you all understood well. Now this topic would be too easy and it would not cause any kind of headache to you. I would like to know your suggestion again for improvement of my lecture. Let me know what else you would like to learn from me. Till that time, take care, stay safe, and if you have not subscribed, please subscribe my channel and hit the like button. Our upcoming videos will be keys of this MCQ along with the concept. I do suggest please watch that video, otherwise your concept will not be clear and it will be too easy for you to have a 6-7 minutes video and you will be solving more than 15 MCQ. It's not a bad deal. In a 7 minutes you will be solving MCQ as well as remembering the concept also. So till that time, take care, study hard, study smart. Bye.